Wow, thank you, Ryan. Those dishes look yummy. Let's now move on to the next segment, Search for Enlightenment. When you registered for this webinar, you also submitted questions about weight management that you would like answered. We have compiled these questions, and our panel of speakers will be addressing the most requested topics. Let us now welcome Dr. Lee Ying Shan, consultant of the Department of Endocrinology, Tan Tock Seng Hospital, Dr. Tan Chun Hai, consultant bariatric and metabolic surgeon of Khoo Teck Puat Hospital. They will be covering the medical and surgical aspects of weight management. We also have Ms. Alviania Chua, dietitian at the National Healthcare Group Polyclinics. She will be covering diet and nutrition. And we also have Mr. Jasmine Haron and Ms. Chua Hui Lin, senior physiotherapist and physiotherapist at Khoo Teck Puat Hospital. They will be covering exercise and activity. And last but not least, we also have Ms. Mabel Yam, Principal Clinical Psychologist at Khoo Teck Puat Hospital, who will be covering the behavioral and motivational aspects of weight management. So now, without further ado, let's begin. Dr. Lee and Dr. Tan, please.
Thank you. Yes, good morning, everyone. Thanks for joining us. Now, the first question that was submitted was, what is a healthy weight? Generally, we use body mass index, known as the BMI, as a guide when we discuss about weight. Body mass index is very easily calculated. So it's basically the weight in kg divided by the height in meters. Let me just start my video first. And if you were to put your weight and your height in the diagram on your right, you will be able to then identify which BMI group you belong to. Generally, if it's a BMI below 23, that would be a healthy weight. BMI above 23 would be in the overweight category. And if it's BMI above 27.5, that would be in the obesity category. But BMI does not take into consideration your age, your gender, or even your ethnic group. So if you have any medical conditions such as high blood pressure, diabetes, sleep apnea, fatty liver, then certainly losing 5 or even 10% of your body weight would bring about improvements in your medical conditions, regardless of whether you are then able to achieve a healthy BMI or not. I'll go on to the next question. So why is weight loss so difficult to achieve? So a big part of the reason is because weight is determined genetically. Certainly, it's also modified by our environment and our habits. Next. So you can see that our body is actually programmed to maintain a certain weight, and we call this the set point theory. So our body reacts sensitively to even small degree of weight loss, and it does some changes without even us knowing. And in doing so, it really aiming to bring the body weight back up to its set point. So if you look at a picture, imagine the water level as the set point, and you do need quite a bit of force to push the balloon below the fluid. And when you release that force, the balloon would then rebound back to the water level. So that is actually what our body is doing whenever we try to lose weight. So it's certainly not because you're doing it wrongly, you're not following the diet correctly, or that you have poor willpower. It's not. It's difficult to lose weight because the body is trying to maintain the set point, and you're really fighting against your body's responses. So that's why managing weight is a chronic, long-term condition, and you really need to have a multi-pronged approach. And finally, the last question: how to lose and maintain weight without yo-yoing? So next slide, please. So one important condition is that self-monitoring, and that is essential. So weigh yourself about once a week. Next. So once you have lost about 5 to 10% of your weight, or even achieve your weight goal, then you should try and avoid regain of more than 25% of that lost weight. For example, if you manage to lose 8 kg, then do not allow yourself to regain more than 2 kg of that weight. So I do use a traffic light strategy. For example, you will be in a green zone if you had maintained your weight or did not allow yourself to regain more than 25% of the weight loss. Then I'll say keep it up, you're doing well. You'll be in the yellow zone if you have regained between 25 up to half of that lost weight. Then really take note, what were the recent events or challenges that had affected you? And certainly, if you have regained more than 50% of that lost weight, then you really need to stop and evaluate. You may need to resume some of the strategies from the beginning. So we know that life is not all smooth sailing. You have your ups and your downs. Sometimes you aren't able to continue a perfect lifestyle. You may have that celebration, that obligatory commitment, and we know that. And that's why it's important to monitor and really catch yourself at certain markers, and then regroup yourself when necessary. So with that, I'll hand it off to the next speaker.
Hi, my name is Chun Hai. Thank you, Dr. Lee, for your introduction on BMI and how the weight yo-yo according to your weight loss program. Today, I'll talk about weight loss surgery. I think one of the questions came in, what is weight loss surgery? Now, weight loss surgery, we call it bariatric surgery in medical term. It is meant that we're doing surgery for the sole purpose of weight loss. Now, bariatric surgery, we have moved away from that terminology. We have now called it bariatric and metabolic surgery, which means that we are doing surgery for not just weight loss, but also with its comorbidities associated with that, which is your hypertension, your diabetes, your cholesterol, your fatty liver, your obstructive sleep apnea. Now, most patients will ask for a sleeve gastrectomy. Sleeve gastrectomy is the most common weight loss surgery or bariatric surgery, we call it. And the other second most common that is done in Singapore is the Roux-en-Y gastric bypass. Now, the Roux-en-Y gastric bypass, from the picture, you can see that it looks a little bit more complex, and we do it more specifically for diabetic patients with a better improvement in your diabetes. Now, the patients will come in and they will ask for a certain procedure, but we will customize and tailor the surgery solution to each individual. Let's move on to the next question. Next slide. Now, can surgery cure diabetes? Um, I would say that surgery do not cure diabetes. Diabetes, with its view for long term, I would say surgery can help diabetes to go into remission. Now, it's very important that we continue our follow-up with the endocrinologist, because whether surgery will cause diabetes remission will depend on many different factors, which includes the duration of diabetes, how severe your diabetes, and how badly controlled or how well controlled your diabetes is prior to surgery, and the type of procedure that we do. It also matters how old are you when you have diabetes diagnosed, and how long you had diabetes for. So close follow-up with the endocrinologist is very important, even after surgery, and when you have control of your diabetes, or when your diabetes going to remission. Close follow-up with endocrinologists will help with your dose titration, titrate down the medications required for good control. And even when it's off medications, you still need the follow-up, because diabetes remission, as the word suggests, means that it can come back, you can relapse, and most of the time the relapse can be associated with weight regain after surgery. Okay, next question. Now, what kind of food can I have after surgery? Next slide. So I think we have seen some of the healthy eating by Ryan, our dietitian, displayed on our how to cook a healthy eating. Can we have the next slide, please? We are also working together with students from the Temasek Polytechnic, and we have and the dietitians with Khoo Teck Hospital. So you can see some of our healthy eating after the bariatric surgery online. Now, typically after bariatric surgery, we will have told the patients that you will have 2 weeks of liquid diet, followed by 2 weeks of pureed food, and then we'll go on to slowly to transit back to your normal eating diet. But it is very mindful that you have to eat very slowly and you have to eat smaller volumes of food. You can go back to your unhealthy eating lifestyle, but I think that's not recommended. So very mindful eating and choosing what you eat and eating slowly, and that will be very important after surgery. So this is the bariatric recipe cards and videos that we are working together with the Temasek Polytechnic students, as well as the staff and dietitians from Khoo Port Hospital. You can find that on our website. So with this, I'll pass on to the next speaker.
Hello, good morning everyone. I'm Alvania, a senior dietitian from NHGP who is based in Ang Mo Kio Polyclinic. There were several questions regarding diet and I've picked up 3 of them to answer today. So firstly, does a keto diet help with weight loss? Next. So what is exactly a keto diet? Unlike other low-carb diets such as the Atkins or the Paleo diet, keto high in fats, low in carbs, with a moderate protein intake. As fat is the main source of energy, can we go back to the previous slide, please? As fat is the main source of energy consumed, body must use this as fuel. Diet is made up of 75% fat, 20% protein, and 5% of carbohydrate. The carbohydrate intake is approximately 20 to 15 grams carbohydrate per day. Carb intake has to be less than 50 grams a day for adequate ketosis to occur. Ketosis also happens during fasting or starvation, or when one is eating very few calories, say less than 500 calories a day. The 20 to 50 grams of carbohydrate now intake is equivalent in carbohydrate terms to just a small tub of yogurt, an apple, and half a medium potato over a day. Those on keto diet use high-fat foods such as butter, coconut oil, cheese, peanut, fish, and full-fat milk to control their diet. And instead of lean meats, dieters often go for fattier cuts. Next. So how does ketosis work? Conventional diet for carbohydrate, you can see that glucose levels will rise after meals, and then our pancreas will secrete insulin. Insulin will then shuffle the glucose into our cells to use it as a form of energy. For ketogenic diet of higher fat, body burns fat instead of carbohydrate, producing ketone bodies, which is made up by liver from the fatty acids. Keto bodies are then used by our body tissues, muscles, and brain. Next slide. So what are the benefits of the ketogenic diet? So it is claimed that it's more effective than other caloric restricted or low carb diet, which is likely due to the body becoming more efficient at fat burning, the ability to consume fewer calories, full from high fat and moderate protein meals. It has also shown to improve insulin sensitivity due to weight loss effects of the keto diet. Low levels of blood sugar may be also due to very low carb intake. However, it's only shown in short-term studies due to the restrictive nature of the diet, and often people has high dropout rates. So the long-term efficacy and safety of the diet is still currently unknown. Next slide, please. So should one embark on a ketogenic diet? The short-term effects of ketosis can include fatigue, bad breath, nausea, constipation, and headache. The weight loss are often short-term and hard to sustain over time. It may also leads to loss of water, causing dehydration. The high intake of saturated fats might also increase the bad cholesterol levels and increase the risk of heart problems. Keto diets are also very low in fiber, and it runs a risk of low sugar for people who are on insulin and sulfonylureas. Next slide, please. So in conclusion, the diet can be an effective method of weight loss in the short term with careful planning, but it is hard to sustain for many in the long term. And most of the initial weight loss of keto diet seen is often associated with water or fluid losses. Next question. Does intermittent fasting help with weight loss? So what is intermittent fasting? Next slide, please. There are two types of intermittent fasting. One would be the time-restricted eating, which is often called the 16-8. So where one fasts for 16 hours with 8 hours to eat. During the fasting period, one can be allowed to drink water or plain tea or coffee without milk and sugar. An example of the eating period can be between 12 p.m. and 8 p.m. The second would be the 5 and 2 method, where it involves the energy restriction to less than 25% of requirements for 2 non-consecutive days per week, with 5 days of the individual eating as usual healthily. So an adult daily requirements is approximately 1,500 to 1,800 calories per day. So on fasting day, a 25% of requirements will be just approximately 350 to 450 calories per day, which is equivalent to just one light meal during fasting. Next slide, please. So what are the claimed benefits of intermittent fasting? It has been shown to cause significant weight loss in short-term studies, but is not shown to be superior to a standard balanced reduced calories diet. It has been linked to improvement in heart health and reducing diabetes risk. But it's difficult to determine if the benefits are unique to fasting or if it is simply occurring as a result of weight loss. Next slide. So, should one use intermittent fasting as a method of weight loss? Intermittent fasting can result in increased hunger and overeating outside of fasting times. There may also be some unpleasant side effects such as fatigue, foggy-headed, affected mood, and feeling hangry, constipation, and also fatigue. There is a risk of low sugar if the patient is on insulin or sulfonylureas, and it is definitely not a magic bullet to improve health. One has to focus on the kinds of food eaten during the eating period, focusing on the diet quality rather than just on calories counting the quantity of the diet. I would strongly encourage you to consult your healthcare provider before starting intermittent fasting. Okay, moving onwards to the last question. What is a sustainable way of eating? Next slide, please. So it will be to follow the healthy plate concept, which is for carbohydrate intake, one should choose whole grains and wholemeal, such as brown rice, wholemeal bread, oats. For protein, we by removing visible skin and fats on certain days and using healthier cooking methods during cooking. Or 2 servings of fruit and vegetables per day. So 1 serving of fruits would be equivalent to 1 handful of grapes or 1 slice of watermelon. 1 serving of vegetables would be 3/4 mug. We also reduce the intake of sweetened beverages and choosing water as our main source of hydration. Using healthier oils, choosing the healthy fats such as our unsaturated fats instead of moderate intensity exercise for 150 minutes per week. Next slide. So some calorie diet. Easy ways would be number one, to eat high caloric food less often. So, example, trying to eat chicken rice less often. Two, eating smaller amount of high caloric food. So instead, don't or a mini one instead. Lastly, to choose healthier version of this food. So instead of eating fish slice bihun with milk, try to opt it without milk. Last slide. So in conclusion, some take-home would be any diet that encourages an energy deficit will result in weight loss. Next slide, please. But for lasting long-term health benefits, it is best to find an eating pattern that you enjoy and can stick with. Remember, fat diets are not sustainable, so once stopped, lost weight will be regained. One can also run the risk of nutritional deficits, deficiency, if plans not practiced. Lastly, exercise need to be included for weight loss. I'll then hand over to the next speaker.
Thank you, Alvania. So for the exercise component, we received a few questions. The first question is, what type of exercise is effective for weight loss? So for weight loss, we want to have large movements targeting your major muscle groups for a full body workout. So why do we want large movements? Large movements help us to burn more calories and hence help us to maximize our caloric expenditure. We also want to try and integrate exercise into our daily routine for long-term weight loss. There are three main types of exercises that we can do: aerobic, strength, and flexibility. Aerobic exercises help us to improve our stamina and heart health. These exercises are walking, cycling, and swimming, among others. Strength exercises help us to build muscle. So such exercises can be done to, for example, such exercises are push-ups, squats, and lunges. Lastly, flexibility can help us to increase our joint range of motion. So yoga is one way to do so. So for aerobic exercises, it should be done on most days of the week to accumulate a total of 150 minutes to 300 minutes per week. These should be done at a level of moderate to vigorous intensity. Strength exercises should be done on alternate days. Aim for 8 to 12 repetitions and 2 to 4 sets per exercise. Stretching can be done at least 2 to 3 times per week, or daily if possible. Hold each stretch for 10 to 30 seconds and do each stretch 2 to 4 times. The second question that we received is, why regain weight when working from home? What kind of exercise can I do at home? So a combination of aerobic and strength exercises have been shown to achieve a maximum result for weight loss. We can also reduce our sitting time. Consider moving around and standing up after every 60 minutes of sitting down. Let's look at some of the common concerns that you may have when exercising from home. So firstly, no time to exercise. Even 10 to 15 minutes would be enough for a workout. Consider circuit or interval training. Circuit training is when you move from one exercise to the next with minimal or no rest between exercises. Whereas interval training, you are trying to achieve as many reps as possible within a fixed time. The second question was no equipment at home. So no weights, no problem. You can use things like rice bags, water bottles, or even a heavy book for your weights. Lastly, we also had a concern that people have no space to exercise at home. So for most body weight exercises, a yoga mat size space is sufficient. So also want to highlight a word of caution before you start exercising at home. Always make sure to warm up before you exercise and cool down after the session. Begin at low intensities, especially if you are new to exercise. Practice regularly and ensure good exercise technique before you progress to things like circuit or interval training. Make sure that you do not rush your movements or sacrifice exercise form when you exercise. Make sure that you maintain good technique throughout. With that, I'll now pass on the time to my colleague Mabel.
Good morning, everyone. I'm Mabel, psychologist from Kutipal Hospital. I'm going to talk about mind and body section. There are several questions that we got. The first one is, how do I stay motivated to lose weight? How do I motivate others to lose weight? I answer both questions at the same time because they are of similar nature. There are a few pointers here. We should start with having a right mindset and then make a list of reasons for weight loss and be familiar with them. Number 3, we actually should begin by setting effective goals, what we call SMART goals, before we start doing anything. Okay, so what is the right mindset? We should ask ourselves some questions to actually have preparing ourselves to have a right mindset. How important is it for us to lose the weight now to make a change? Are we really ready for the change? And also, how confident are you to make the change? So the first one is, are you really ready for a change? What do you need to make a change in your diet and exercise habits? What are the benefits, of course, to make the change? Because there could be many other things in our life right now that we need to attend to. But if we're prioritizing weight loss, we actually can spare time for it and make sure that we have projected time for making the changes along the way in our routine. How important is it? It will help us to prioritizing weight loss. Why do I want to lose weight now? What can I do? What does it mean to me if I lose the weight to make this change? Is it for myself, or is it my family or other people is asking me to? It will be definitely better if the motivation is from yourself. And then the number 3 is how confident you are to make the change. Do you have the support or skills or knowledge to lose the weight? If not, how can I acquire them? Can I get it from someone who lost weight before successfully? Or can you get some professional advice, like joining a weight management program? Next, what are some of the right mindset that we can have? We should prioritize our weight management. Okay, so if we want to do something, we need to make time for it. Number 2, behaviors have been learned. So there are some habits that may not be very healthy and helpful. We can actually change them. So don't worry, it just takes some time. So similarly, some healthy habits can also be built and learned. So that's why we just take some time and make the changes along the way. Think positively and rationally, so it will prevent you from being trapped by the negative thoughts, which may not always be true. Tell yourself that you are in control. You can make the decision to eat healthily and to exercise. This is your choice. Think about weight management is a way to treat yourself well. So it is worth the effort. So it's for our own good. We can be more energetic. We can be healthier. We can look better. We can wear the clothes that we like to wear. Number 6, be realistic and expect setbacks. It is very normal for us to experience lapses. So it is okay, as long as we are aware of them, we get back on track. The next way that can help us to stay motivated is actually go through a list of the advantages to losing weight. So what are the reasons for us to lose weight? I want to look better. My energy level will increase. I'll be able to wear clothes of a smaller size. My blood pressure will go down. My cholesterol level will be reduced. I won't feel so self-conscious in public. I will have the sense of achievement. I'll make better impression on other people. My family won't remark about my weight. I will be a role model for my children or friends, etc. and etc. If none of these is on your list, it is okay. Make your own list and be familiar with them all the time. Read them, review them. From time to time, it will make them more readily in your mind to help you stay motivated. The next thing is about setting effective goals. Don't make very difficult goals or do not want to make too many changes at one time. Okay, what is an effective goal? It's a SMART, SMART goal. Have to be specific enough, measurable, achievable, realistic, and time limited. So if I say I want to lose weight and I have the goal is like, I just want to lose weight, it probably doesn't tell you what to do to lose weight. So an effective goal is have to be very specific. After you make it, you don't really need to think about what to do, where to do it, how to do it, how much I do it, or when I'm going to start. So if I say an effective goal will be, I go to the pond nearby in the Yishun Park and I walk 2 rounds every day after working hours, starting from next Monday onwards. So it is so specific. Next week, I just go and do it. It's not good enough, this goal. We can have a smarter goal. SMARTER. E stands for evaluate. After we do it, I probably will evaluate whether it is smart. If it is not, let's revise it. Don't drop any goals. Okay? If you drop it, you're as good as no goals, no pathway to achieve whatever you want to achieve. And then, if you succeed, celebrate every success you made. Okay, there is another question I received. How do I control cravings? There are a few pointers here. Let's have rational thinking again. Wait and distract ourselves. If nothing works, eat in moderation if we need to. And the next one is actually schedule time for favorite food. So we will not go out of control very easily. So what are some of the helpful thoughts? For example, say no to extra food. When we actually have some food that we want to have, ask ourselves, okay, is it too much that we are taking in? Or should I leave it there or throw it into the dustbin or in my body? What are the more long-term costs if I'm actually having it in my body? It could probably like the food only worth of $2. Okay, but if in my tummy and I consistently having this habit of eating what is not needed, is too much, I probably accumulate a lot of food and that is not needed in my body. Eventually, I might have some health issues, and it not only to cost me a lot of monetary cost, but also lifestyle cost. It may limit my quality of life, not being able to walk because I have knee pain, etc. Number 2, say no. No excuses. Just because I want to eat it, does it mean that I should? Probably not. If I'm not hungry, probably not. I just had it before, 2 days ago, probably not the right time. Okay. Don't be deprived. It is okay sometimes if it is like, we don't need to go to the extreme and say that like we at all times not going to have my favorite food or like to soothe our cravings. I can include in my favorite snack in my diet as long as the amount is reasonable, and I modify my diet plan accordingly. So maybe at the next meal, I eat a little bit less of the other thing if I want to include a very controlled amount of the snacks in my diet today. Another helpful thought would be, I'd rather be thinner. Being thinner is so much more important to me than eating this unhealthy food. Tell yourself it is more important, is above all the other things that I want to have right now. So if I want to keep to the right track, I rather not having this craving, not having this food that I'm craving for right now. The last one is a read the advantages card every day. Just now the list that we went through, we would want to be familiar with it as much as possible. So go through them again, especially when you have the urge to eat the food that you're craving for, especially when they are not very healthy. Other things that we can do other than having the right mindset and challenging the negative thoughts, we can also distract ourselves with an activity. Okay, wait 10 minutes to see if the urges pass. Find alternative to soothe ourselves, because the cravings normally doesn't come when we are actually hungry, but it's as and when that we feel like having it. If you really need to eat, find healthy alternatives and eat in moderation. Okay, control the portion size, it will help a lot. And also plan ahead when to have the favorite food. If it is planned, I can tell myself that, okay, I'm having it in a week's time, I can wait. It's not like I'm not going to have it. It's just not now. It is fine. I can do something else to actually help me to feel better. Thank you very much, everyone. I'm passing the times back to my host.